I'm here with Dr. Nootheti today, and we're going to discuss some non-surgical things we can do for your skin. Give us some, you were at the Spa MD, right?
La Jolla Spa MD in downtown La Jolla, exactly.
Great. And what is you're certified?
I'm board certified in dermatology and also practice cosmetic surgery as well.
Great. And where did you go to school?
George Washington University in Washington, D.C., back on the East Coast.
Ooh, fabulous. Yeah. Love me some East Coast. We have a lot to discuss today, so I'm actually going to use this paper here. I'm a little dorky, but I didn't want to miss anything. Our first topic is, I wanted to talk about some skin-specific problems in women of color, like hyperpigmentation, large pores.
Of course.
Do go on.
Okay. Obviously, one of the top 5 major concerns in women of color is hyperpigmentation, acne, dry skin, eczema. Hyperpigmentation, ethnic skin is the problem is that the cells that produce pigment are hyperactive in people with ethnic skin. So anytime you get any sort of inflammation, irritation to the skin, you get the hyperpigmentation. So the best thing obviously is to avoid it by preventing the trauma or preventing the incidents, but there are definitely ways we can treat it easily.
Okay, what would you recommend?
A lot of them are a combination of bleaching creams that we use, medical strength bleaching creams, that actually help lighten up whatever pigmentation was caused. So we can see them and prescribe that for you if needed.
Very cool. So, not that, you know.
You don't need it, of course.
But I was curious, and our viewers are curious. The second one is proper face washing. I would love this question. What is better? Dispel some myths. Is soap better than creams? I mean, I use Pond's. Is that okay?
Anything is fine. The most important thing is actually better than both of those is using a cleanser. Something that's mild, a gentle cleanser, not too many perfumes, so you don't want all this nice fragrances and stuff. You just want something very bland, a gentle cleanser. And then important as well after is a toner, because a toner will reset your pH from what the soap, the cleanser took off. So a gentle cleanser and a gentle toner is all you need. It doesn't need to be fancy, it doesn't need to be super expensive, no perfumes, just something gentle.
What does soap take away that the toner gives back?
It balances your pH. It messes up your pH, so the toner restores the pH back to your skin.
Okay.
So.
Now I actually don't wash my face, but I don't get problems. I'm curious, and I've met a few people that do that. Is that something that is that okay?
It's okay. You know, obviously it'd be recommended with a cleanser, but it's fine.
Okay. So how come some skin doesn't break out if they don't clean, or it's just your face is balanced?
Some people it's just the bacteria count, some of it's genetics, it's a lot of different things that cause acne, but those are some foods is another problem, so a lot of different things, and obviously dirt and oil also. So.
Okay, cool. The next one. Can we believe the claims of most face creams about antioxidant properties? I know you have a product right now.
Yeah, let me talk about antioxidants. Antioxidants are very important. You can find them in various sources. You can get them in food, which is probably the best source you can get naturally, and then you can also put them in creams and products and stuff. We actually developed a great product line at La Jolla Spa MD. It's called the Vitaphenol product line. The greatest thing about that is they've discovered this exotic fruit called mangosteen, and it's got the highest level of antioxidants you can ever find, and it's incorporated into that along with pomegranate, white tea, and green tea as well. But yeah, the important thing about antioxidants is that they do actually repair sun damage and some of the damage of aging. So
really, and that's proven?
Yeah, it is proven. Especially with the Vitaphenol product line, there's a couple years of research done that actually showed that it actually works. So with any product line, if you have the antioxidants in it, it definitely is important to use it.
Okay, cool. And your research, is the research conducted at?
We have a separate research department that's separate from the whole entity. And yeah, it was about 2 years of research that was done on random patients and collected data and analyzed. And so.
Oh, cool. And where's this fruit, is it imported or?
Yeah, it's actually in the Southeast Asia.
Oh,
is where you can most commonly find it. It's called mangosteen.
Mangosteen?
Yeah.
And what was the product called again?
Vitaphenol.
Vitaphenol.
Yeah.
Okay. Yeah. Next one is, are we missing out on nutrients when we only use natural face products versus cosmeceuticals? And I'll be more clear, natural versus science. You have chemicals, antioxidants, whereas natural and handmade is, it's right there.
Well, not necessarily. Natural products do, depending on what ingredients are involved. Some natural products do, the botanicals do have retinoids, carotenoids. So if you can find some products that do have that, natural is okay, but obviously coming from a medical background and seeing the research, it's always better to have some products that have stronger, because the level of antioxidants that we have in some of the products are stronger than what you're going to find in natural products.
You put it in there versus
finding
it.
Right, exactly. So it's a stronger strength, and it's developed more into your skin. But on the other hand, using something is better than nothing. So definitely use something at least.
Okay.
Yeah.
So is it So is more always better? Like, do you want to cram as many antioxidants as possible?
Not necessarily, because there's a certain point where it's going to be saturated into your skin, and your skin won't be able to absorb anymore. So.
Okay. What happens if you have like too many antioxidants on your skin?
Nothing. It just won't absorb.
Okay, just hang out there.
Just wasting money. Yeah.
Okay. And our last one is I'm curious. The 2 outpatient procedures to tweak like fine lines and wrinkles. Everyone wants to know about this.
Right,
Please tell
and
me.
the trend nowadays is going away from major surgery. No one wants downtime anymore. Everyone has a busy life. No one wants to know that you actually had a surgery done.
Yeah.
So we have now actually very simple procedures that you can do as an outpatient, no downtime, very simple. You can have the procedures done, and no one will even know you had it done. You can go back to work, go back to the office, friends, whatever, do whatever you want without interrupting your life. One of them is called the Affirm. It's a simple 5-minute laser treatment, outpatient, that actually stimulates collagen underneath your skin. So it leaves your outside skin alone, doesn't damage anything, and it provides energy to stimulate collagen underneath. And what does that do? What is collagen? Collagen is something that we lose every day. We're both losing, unfortunately, but what it does is it forms wrinkles.
Don't tease me.
I know, I'm sorry. It forms wrinkles and it helps lose the skin elasticity. So this helps provide some of that growing back into it, and it's simple and easy to do.
At what age do you start losing collagen? Is it when you're born? Does it start? Or?
No, it's sometime in your mid to late 20s is when you start reaching start losing collagen.
Without surgery, what would you recommend?
And there's another procedure called Sculptra, which is a liquid facelift. These are liquid.
Oh, I see. Liquid.
Yeah, it's a liquid injectable medication. It actually provides facelifting results. It's a 5-minute procedure. There's a couple of needle sticks on each side of your face. No surgery. Once again, you have the procedure done, go back to work, visit friends, whatever. And it also stimulates. It goes a little bit deeper and also stimulates collagen too. And it lifts up sagging skin and fills in wrinkles. So it's a great product.
Okay. Are you hinting? I'm just kidding. I'm so excited about this information. I really wanted to know about all of these topics. Where can we find out more about what you do personally?
If you can go to www.spa-md.com, and you can find out more about our facility and all the spa procedures and medical procedures that we do.
All the treatments.
Yes, exactly.
Okay. Well, it's a pleasure having you.
Thank you. It's a pleasure being here.